Hello, good morning. Good morning, everybody. Yeah, it's Auntie Boleh again. Yeah. So today, Auntie Boleh is the 94th time. Yeah, that I'm meeting up my guests. So 94 times actually is a very big challenge for Auntie Boleh, and I'm so happy, and I'm very thankful to everybody that I'm here today. That I'm already in my 94th times. And reaching 100 another 6 session. Yeah, maybe I would like my friends here, yeah, to let me know what would you like to see after 100 times of Auntie Boleh. Yeah, we may give suggestion on that. So Auntie Boleh wish to do more because for my age, I think this is something that I love to learn and I love to share. So there are so many things that I learn, and I'm so happy to share and make a history of my life. Wonderful. Is so thankful to everybody who's supporting me from the very beginning till now. Yeah, good morning. Whoever that's in now, come say hi to Auntie Boleh, and I wish to know who is with me, and I wish that there is more of a two-way communication. Yeah. So today, please do not hesitate to write down what would you like to Auntie Boleh to do after the 100 times. Yeah, I wish to, because in my mind I'm thinking I wish to visit more of my friends. You know, I feel that, yeah, I mean, I'm not racist in a way, but I feel the Malay ladies, they are so good in cooking, you know, and especially I love Malay food. So I wish that maybe I can go into our Malay friends, well, ask them to teach me those spicy food, which I love the best. And I hope that my friends, we all will be able to recommend. So, okay, come to our today, my guest. Today is a night, and I'm so happy that I'm able to invite, also consider friend because I know her earlier, is Miss 𝗕𝗏𝗵𝘀. She is a psychologist and she runs a consultation, the consultancy clinic, yeah, in 2018, where she is doing consultancy we call it patient or we call friends or whatever, which come to her. So in our head now, we may be thinking of psychiatry, psychology, and consultant. Yeah. So we would just like to welcome her and let her tell us more. What is it about psychologists? Wow. Isn't it wonderful to follow Auntie Boleh's Facebook? Yeah. So now let's welcome Miss 𝗕𝗏𝗵𝘀. Yes.
Hi, hello
Hello.
everybody. Hi, Auntie.
Yeah, good morning. You see, look at our 𝗕𝗏𝗵𝘀 here. It's a very bright, cheerful morning, and to see her, yeah, thank you for being so cheerful. Also, yeah, because it
Yeah.
a lot of difference, you know, it attract the energy. Yes. I think today, because I think most of the people are out pergi
Yes, for mengundi.
election, but it doesn't matter. Anybody can watch later. Yeah. So it's a big
Yes.
day for us. Also a big day for Auntie Boleh. I'm going to vote later, and I'm so happy to have 𝗕𝗏 with me. Yeah, 𝗕𝗏, I know that you are running a clinic, but anyway, you are a psychologist. Yeah,
Yes, that's
psychologist.
correct.
Yeah. Sometimes I know that people, they have problem before going to psychiatrist. We know that those are mental, they need to take some medicine. Yeah, that's for psychiatry side. But for psychologist and consultant, which I somehow sometimes I do really have a mix, not clear in a certain line, let's say. So as a psychologist here, 𝗕𝗏, would you like to tell us actually what is the difference, yeah, between a psychology consultant and maybe the counselor? Yeah, would you like to tell us on this? Yes, thank you.
Yeah, okay, boleh. No problem. But before that, thank you, Auntie Boleh, for inviting me on this very wonderful platform. I have also been watching your live, okay, and it was really interesting. So everybody, welcome, and continue to support Auntie Boleh. All right.
Okay.
Okay, so for the first question, yeah, what is the difference between a psychologist and a counselor? Okay, so psychology itself, the meaning is the study of human behavior. So that is what psychology means, right? So when we become a psychologist, it means that we have go through the learning of how to read people, why they act certain way. So this why when we are a psychologist, it's very hard to get mad at people because you always know why they are like that.
Oh, the story behind.
Yeah, the story behind that. So they're like, they're getting when people are angry or when they are sad. Actually, it is the same emotion. It's just how you show it, whether it's inwards. So when you are sad, you show it inwards. When you are angry, you show it outwards. But actually, it's the same emotion. It is the same frustration. Okay. So for a counselor, they actually have very basic learning of human behavior, but they are more majoring in how to empathize, being sensitive towards your problem. So a counselor is actually an active listener. Very good. But whenever you go and meet a counselor, they can always just be like this. I see. Oh, I'm sorry to hear that. Okay. But they cannot like give you any advices, like they cannot interfere in your life, or they just can empathize, listen, and let you process your problems, right? But for a psychologist, we are trained for a psychotherapy session. Okay, like for a cognitive behavioral therapy is actually how to rationalize the negative thoughts.
Oh.
Yeah. And then we have the talk therapy. So the talk therapy is actually the same as like when you are meeting a counselor. The talk therapy is just being there, being attentive, listening, and let you have a safe space for you to share your qualms and your problems. Okay. And then we have the dialectical behavioral therapy. So this is more of being mindful towards yourself. Because sometimes when you are having problems, you are focused on the problems, right? So it becomes overthinking, and then you have these thoughts, choo 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 choo. Okay. So we just want you to wait, take a breath, stop, and where are you right now? So just be mindful about your surrounding. What can you hear? Calm down. So we try to distract you from thinking about the things that makes you anxious, anxious, and anxious. So that's the difference between a psychologist and a counselor. So we have different types of psychotherapy compared to a counselor.
Wow, thank you, Aqeelah. For this very short explanation, actually, it makes us understand a little bit extra. Yeah, those my friends here, whoever are here, can't say a hello to Auntie Boleh. At least then I know who you are, and welcome, okay? And please do not hesitate to write down any question if you feel like you want to ask. It's a wonderful opportunity to ask Miss Aqeelah. Okay, Aqeelah, just what you say about a counselor. So it's more on those listen, more attentive to listen, and then the patient itself is, you just want to tell out and somebody to listen to your problem. And
Yes.
at the end, we still need to, maybe they somehow help us to understand our own problem, and yet we need to actually settle or do it ourselves. Where psychologists go more than that to let us recognize more deeply on what are we, yeah. So it also is a very so that means, but when by what okay, let's say for a psychologist and counselor, because as you say, counselor is more on listening, and at the end they cannot solve our problem, right? So that means would you like to talk about, let's say how would people know that I have this situation where I need to see a counselor, or do I need to see a psychologist? Because we don't know. Yeah, sometimes we say we actually, I see a counselor will do, and then it doesn't help. So we don't know. Sometimes where should we go to? Yeah, Pauline, good morning. Senghua, good morning. Yeah, Mahanama Chen also. Yeah, good morning to have friends here with me. Yeah, okay.
Yeah.
So Aqeelah,
Good
would you like to
morning.
answer on just now that one? How would we know that who should we go to? Yeah.
Okay. So usually we have a lot of counselor located at different premises, especially in the government sectors. But at the same time, we also have a psychologist located. Okay. So usually counselors are meant for stress management.
Stress management. Okay.
Or when you are having decision making skills, you might also be referred to a counselor. But at the same time, that things can also those people who are experiencing the stress management and the decision making skills can also go and see a psychologist. So this is where we have the same kind of combination of patient. However, for a psychologist, our patients are more like when we are dealing with some anxiety or depression. So we have also the clinical psychologist part, you know, so sometimes we met the clinical patient. But for counselors, they are more on the industrial, organizational and industrial. So like maybe yeah, when the employee have some problem, stresses at
Oh.
home, so they need to talk to someone. So then you meet with the counselor. But also we have counselors in JKM, right? So for that one, they are trained, okay, to help with people dealing with issues with trauma. So yeah, counselors can also deal with trauma healing.
So actually, so small stress management and all this is our counselor, and where they are. Can I put it this way, like for this as we know that it's more on the surface thing lah. Is it counselor?
Yes,
Totally involved.
yes,
Yeah. So yeah. Good
yeah.
morning, Li Hua. Yeah. Okay. So somehow we just managed to get to the line that some counselor and a psychologist. So we roughly know. Okay. Let's say okay for as what you say, you are in this psychology. So would you like to tell us, okay, what is your biggest challenge, you know, as in your work, you as a psychology consultant? Is there any challenge you are facing, something like that? Yeah.
Yes. Okay. So my biggest challenge, since even when I was having my training in HSA, my biggest challenge is always the speaking. I mean the barrier, the language barrier.
Oh, yeah.
So just aside from having the usual general cases, I also have sexual assault cases, you know. Sometimes I cooperate with the police, okay, to help maintain the victim moral support, emotional support. So there was one time in 2019. In 2019, there is a very unique case that came to my door. So this person actually specifically requested for a Mandarin speaker punya pegawai. And then I was like, okay, I don't know how to speak Mandarin, but yeah, I can refer you to my friends, you know. So I referred this patient to another psychiatrist, actually, especially psychiatrist who can speak Mandarin. But then she still comes back to me and be like, you know what, I'm still comfortable with you. So I have to have a translator. So at that time, Esther was my translator.
Oh. Esther smiling.
Yes,
Yeah.
yes, Esther Smiley. Yeah, she was my translator, and yeah, we managed to help the grandma, you know, as best as we can. Because sometimes she would call me and then she would try to talk in Mandarin, and I was like, okay, auntie, jangan call, saya tak faham, tapi you WhatsApp. So when she WhatsApp, she actually send the Mandarin Hanzi kan character. So I will Google. I will Google and then I will translate and then I will give my answer and then Google also lah. So after that, I decided that, you know what, I need to learn to speak Mandarin. So
It's great.
现在我说一点汉语。
Yeah, it's wonderful. I mean, it's good to have Esther smiling to assist. I mean, Auntie Bole also here. Yeah, I do know Mandarin. If you do need our help in a certain way, yeah, I can offer my help to you over some of those translation. No doubt my Mandarin is not so very good, but I think with the simple one, I'm able to do so. Yeah. So one of the challenges you face is the language problem. Yeah, because we have many races here, we everybody have their own problems, right? Yeah. So this is our biggest challenge now over in your work lah. Okay. Yeah. Also another thing is that you say, okay, no, how would you get people to trust you? Sometimes nowadays people don't simply trust anybody, right? You see, how would I trust you as a psychologist? You know, because how you make people to trust you, and how do you know? Okay, we come to this question, but how will you make people to trust you? Sometimes I say, hey, I just first time I know, how can I immediately tell you all my problem? Hey, what if somehow you get to let people know about my problem? I don't wanna, something like that.
Okay. So yes, actually, the trust issues is always there, but somehow or other, yeah. You know, I always get this from my patient actually. When they come here, they will be like, I don't know what to say to her, and I don't know how much if I'm going to overshare or anything like that, or what am I ever going to talk to her. But whenever they just come into my room. Actually, I'm here in my clinic, so this is my room setting. So you
Oh,
have the
oh, ah.
okay, so
Ini
all the toys and
ada banyak toys juga kan? Okay.
yeah, because yeah, I managed from 4 years old until the 70s. So so whenever they just sit at my sofa, they'll just suddenly be relaxed, and then we
Hmm.
start to share. So sometimes they would say, I want to have a session with you maybe for 30 minutes, but it ends up for 1 hour and a half. Or sometimes the session is only for 1 hour, but it end up for 4 hours or 2 hours.
Hmm.
Yeah, they just don't want to stop talking. So yeah, I don't know, but I get it a lot from other people that they said that maybe it's my humble personality, that I did not judge them. And when I actually give output, after they tell me their problems, I actually tell them, oh, okay, so this is happening because of, okay, you're having this kind of issues, and what we're going to do is like this. So like I always explain to them about everything that they share with me, like, okay, we're going to help you through this. So yeah, a lot of them say it's just my humble personality that makes them feel comfortable. Like even parents, right? Sometimes they will tell me, I think you're a scam.
Yeah,
when
yeah,
the
yeah.
first
That's what
time,
I say. People
when the
nowadays
first
they
time.
us. Yeah.
Yeah, so but they still come and send their children to give them the opportunity to come to meet me, because they have met a lot of other psychiatrists or psychologists, and they feel like, I think they are also scam, but I just feel like, because my child says that they wanted to see, so I just try, like, I just give it a try. But yeah,
Yeah.
end up even the parents said that, yeah, okay, I think, I'm glad that I met you, because the differences, that this is also what the parents told me, is that I always tell them what is happening. So like I keep them in the loop, and
Hmm.
I give them knowledge of how to manage, how to handle. Because whenever I have any children as my patient, I will talk to the parents as well, and I will make it into a family therapy once in a
Hmm.
while, because it's very important for the parents to know what's going on and how can they help them at home. The only problem is when the children is in, like, very resistant towards, I don't want my parents to know, I don't want my parents to know, because sometimes I have to,
Ha.
hmm,
Mm-hmm. Yeah, yeah. That's what I feel. Sometimes we say, "How can I trust you? Will you tell my secret to?" Huh? Sometimes, yeah. Even nowadays, children also they have their own secret, which they feel that they want their parents to know. Yeah,
yeah,
yeah. That's why you come to this point, yeah, Akila. So you say, okay, nowadays there are many abuse, so many different kind of abuse within children and teenager. You see,
yeah,
so as a psychologist, yeah, this is a very, I feel that my friends here, whoever is here still, please ask any question which you think that you would like to Akila to answer. You see, like now we are facing this era, is there are many kind of abuse. We say, let's say for children and teenagers first, okay. How do we, or how are we to aware that there are different forms of abuse actually already experienced by these children, I mean children and teenagers. How are we going to aware these forms and how are we going to help them? Okay, as you as a psychologist, yeah. Let's talk
okay,
about this abuse, yeah.
okay. So when we are talking about child abuse, there are very different forms. So the common forms is the physical abuse, okay, and then we have the sexual abuse. Also, is very happening a lot in our country, yeah.
Mm.
Okay. And then
Yeah.
we have the neglect, okay? And then we also have the verbal abuse, okay? So, what I wanted to focus on today is actually the subtle abuse of mental abuse, where you actually neglected your children, and also when you actually verbally like abuse them, but you did not aware that it's actually a verbal abuse. Because sometimes when you're talking about verbal abuse, it could be just simply when you are, talking down on them. It's actually kind of a verbal abuse also. But what people think of a verbal abuse is only when you marah-marah.
Uh, mm,
Okay. But actually, if you are comparing them, it will affect them emotionally. So lately, I have an increase of cases where my patients are teenagers. All right. So their parents is like, I don't even understand why my son wanted to meet you. So the son is 16 years old. because I asked, so whose idea is it to come to see me? And then the parents said, it's their own idea lah. You know now social media, they just check and then they just Google the things and then they think they have some problem and then they say, okay lah, I want to see a psychologist or I want to see a psychiatrist. But the parents nowadays kind of like being more open-minded to take them to see compared to, you know, when our old days, they probably like, why you think you're crazy? You don't want to be crazy.
Nice to hear that. So people acceptance on that. Yeah,
their acceptance. So when I come and talk to him, it just so happened that he is a 16 years old boy who go through bullying. This is also very common among the patients. They all go through the same things, which is bullying. All right, but whenever they go home and talk to the parents about it, the parents is like, "Ayah, you just settle it on your own lah," you know. Or like, do you want me to talk to the teacher? Or what do you want me to do? You fight back lah, you know. So those are the kind of things that the parents actually teach them. But what happened is when the student, either they tell the teacher or they tell the parents, the bullying still happen. After the students who bully actually scolded them, I mean the teacher scolded the students who is bullying, they will still come back more aggressive and more hostile. Or sometimes the bullying happens inside the house itself, you know, between siblings. But you know sometimes when you have a lot of even me lah, my daughters will be like, Mama tengok tu Mina, Mama tengok ni Fia. So you know like I always have to turn and tengok. But you know being the parents, you know that kenapa lah I ni dah balik kerja penat stres you tambah macam gitu. You know, but I actually have to be there and be like, okay, tengok, you know. So like I have to validate. So this is what I wanted to share today. It's validating and communicating the right ways when your children is having problems. Okay, so for example, this technique is called a Deci technique. It's a DESI. All right. So D is for the describe the situation. So that when your children comes to talk to you, you have to be interested to their story and be like, oh, can you describe the situation? And then, you know, you will say that I was bullied at school. So that was like very vague and general, right? So yeah, describe the situation. Where it happened. Is it at the stairs? Is it in the class? At what time? You know, so it looks like you are very interested in their story about the bullying. Okay, so at that point, you give them the space to vent out. All right. And then you ask them, so how do you feel? So E is actually the emotion coming out from that situation. How do you feel? And then probably the child will say, I'm sad. Or maybe when they are older, they will use a different vocabulary, which is I feel helpless. I feel useless. Because depending on their age, they will have a different vocabulary.
Okay.
All right. And then E, and then the S. S is suggestion. Suggestion is actually for how or what can I do to make you feel better. I'm so sorry that you go through that. That is very awful, you know. So like you have to empathize. You have to validate their feelings, you know, because they are very helpless. And at that time, you are teaching them that their words matter. Their voice is heard. Okay, this is what parents should do, because at the, you know, during my generation, we learn the idiom, children should be seen, not heard.
Not to be heard, listening. Like Danny said, listening therapy is a good tool. It's good tool.
Yeah, Danny actually helped with the case also, you know, he was the, I mean, hi Danny, long time no see.
The president of Befrienders Johor Bahru,
Yes, all right. Yeah, okay. So, so at that time, you have to comfort the children, okay? Because we want to empower the children. This is the thing about empowering. Empowering is not only teaching them to be confident or anything like that, but it is also teaching them how to cope or how to manage when they are going through a stressful situation. This is very good to teach them at a muda-muda lagi, you teach them. So this can help them because their brain is still developing, they are still creative, you know, they are still active at that time. Okay, so the I is improvisation. So improvisation is actually when you give them the idea or the suggestion which can help with the situation at number one. So it's like you are brainstorming. Okay, so what shall we do about your bullying situation? You know, like you have to discuss with the children because if you learn about the hak anak-anak, okay, the children's right, they have the rights to be involved in when you're discussing anything about themselves.
So nowadays they're different, you know. Last time, yeah. But now so they have the right to voice up whatever is in them. So they have more on, you know, human rights also from young already nowadays. They have that. Yeah, but
Yes.
we say about this kind of sharing what they have, but sometimes this is a sort of. I'm not saying that it's not serious. Yeah, sometimes verbal abuse or being bullied, but sometimes it comes to be like sexually abuse. You know, this kind of thing. Where how would the parents actually need to understand and realize that their children are under this kind of a very serious abuse. How would
Okay.
you go aware of that? Yeah.
Okay, so let's say your children does not come and talk to you about it, all right? So the signs that you should be aware of, for example, if there are differences in behavior, if you feel like they have trouble sleeping, you know, probably you start to realize that your children's sleeping habit changes. Probably he's sleeping all day. Okay, or probably now he starts to don't want to go to school, feeling scared and always coming up with excuses like I don't want to go to school. You know, you feel like this is like when people label you to be lazy, but actually no, there is something wrong with the children. Okay, and then even if you pee during sleeping, so peeing at the bed, you know, at the age where you should not be peeing, as is actually a sign of anxiety. Okay. So what happened is sometimes when you experience a traumatic event, it stays in your subconscious mind. All right. And you try to ignore it, you know, and then you become anxious. And then you go to sleep. But then your mind, the subconscious mind starts to come out as a nightmare. Probably you feel like you are running away from something, you know, or you feel like you are being splashed with the water or something that makes you, you know, pee uh, at the bed. So that is the sign of anxiety. Okay. And then the appetite, whether they start to eat more, you know, try to become fat, or they start to eat less. The changes in clothes. Are they wearing layered clothes? You know, and then maybe in terms of the appearance, maybe they start to always look down. You know, even when they walk, they just look down. They don't want. We are supposed to walk and look in front, but they actually look down. You know, like that.
So
Okay. And
sometimes
then when they start to become sad, and they start to become isolation, start to lock themselves in the room, start to become sad, and they don't want to, you know, participate in anything. If you try to, and they say like it's okay, I'm fine, nothing's wrong, you know. Because sometimes they don't know what to say or how to say it. Okay, so maybe you can say these words to them. Honey, I think I'm seeing you're having something troubling you. Okay, you know, you can tell it to me, right? I will always be there to support you. Or when you are ready, you know, come and talk to me. I want to help. So you can say that like giving them the time and space to be ready. To talk to you. Okay. So sometimes when they are refusing to talk, you can it will come to your mind. What's wrong with my baby? What's wrong? What's wrong? You know, did they do something shameful? Okay, then you maybe start to overthinking, right? So you say, oh, if you do something shameful or anything that ruin the dignity of the family, also you please come and talk to me. We'll figure it out together. We are a family, right? Mm.
Yeah. I mean, it's nice to hear from what Ivy say. If you want people to listen to you, you listen to them first. Listen to your children first before you talk. Yeah, sometimes we
Yes.
halfway, we macam tak boleh tahan, no patience. Halfway they speak, and then we interrupt already. But then according to just what you have just said, Akila, sometimes it's so sad because this is a true incident of what you already said, right? Sometimes it's so sad, after even I hear what you just say, I feel sad for those who are actually under sexually abused. They're so young and they don't know anything and they don't know how to say out, you see. So that means parents, we must be in a situation, as you said, be aware and look at things that abnormally, they behave
Yes.
abnormal. So it's so
Mm.
sad lah. But then we have to do something about it lah. So
Yeah.
that means what we can do is to, let's say we bring them to see a psychologist. In what way that you all can help them?
Okay.
Because things
So
already happen. Yeah.
Okay. So let's say the parents doesn't know how to tackle the problem, then they say, okay, come, I wanted you to see a doctor. You know, the doctor is a friend of mine. Usually the parents will lie and say the doctor is a friend of mine. You talk to the friend, you know, and then they will call me, oh, I tell my children that you are actually a friend of mine. So just say that we are friends and you know, we just want to talk. So I said, okay, no problem. You know. So yeah, because I guess it's easier for them to trust stranger than the parents. Why? Because when they are up, you know, when they grow up, they see how the parents always reacted, or maybe they see the parents quarrel, you know. So at that time, or at that point of time, they will start to have the trust and mistrust, you know, decision making. Actually, from baby to 2 years old until up to 6 years old, the children are always testing you because they want to build the, can I trust my parents, or can I not trust my parents? They have already do that in the early age. They have tested you with many things, even when they quarrel with the brother, and then say, okay, let's see, my parents are, who are they going to side with? So they are actually testing the parents, you know. So that's why when they're having some problem, if the early age, okay, at the early development, they have already have this, I cannot trust my parents, then it's going to be hard for them to talk. And sometimes the parents might tersalah pandang, you know, because they thought it's the hormone changes. It's the, oh, it's a teenager thing lah. It's a hormone change lah. Never mind lah, never mind.
Yeah, many
Ah,
things. Yeah, you say so, yeah.
hmm.
So it's always not easy. We because for last time things not so much like social media pun tak sangat laku ke apa kan. I think it's so easy,
Betul.
but nowadays they are so different. So the first thing is we must let our children to trust us first.
Yes. Yes. Yeah.
So it's always so many things that we can talk about. Today we like Danny said, is sometimes the children are feeling helpless and isolation. Sometimes they don't know because they don't have the trust for the parents or what. So
Yeah.
that's something is actually very horrible. I feel that way. They have
Yeah.
nobody to turn to. So my
Yeah.
friends here, later I will put up a WhatsApp, a Facebook page for Akila. She's a
Yeah.
psychologist. So if there's anything which you think that maybe your friend need it, somehow we don't know when and how we need it, please do not hesitate to contact, because Auntie Bole is here to let others know that Miss Akila is here to help to further on fees or whatever. You all have to go to her and find out and all these things. But there's a channel, at least we know who we can go to. So also
Yeah.
at last, okay. What are your views on parents? Let's say nowadays parents, there are many, they are working. They say I'm working, they have no time for the children. So what advice or what views would you like to talk to the working parents on this kind of issue? Yeah.
All right. Okay. So, for the working parents out there, I mean, I can understand your exhaustion, you know, from working morning until evening. Okay. But at the end of the day, your children needs you because they're still a child, right? And you have to remember sometimes, you know, the parents will be like, I have done everything right. So why is this happening to my daughter also? You know, like I give them food, okay, and then I give you money for school, I send you for tuition, you know, but you're still giving me troubles, you know, and stuff like that. So what the children needs is a quality time, even in, you know, 24 hours in a day. you just spend 1 hour. If it's very quality for them, they actually appreciate it. Or maybe 2 hours at the max, you know. So because you have to let them know that you can be the pillar that they can depend on. Okay. So yeah, I mean, even as a working parents, you also don't forget your own me time. Okay, please make a schedule. Okay, this one I give advice lah. Please make a schedule of your routine. All right, and then in that schedule, when you put down your working 8 to 5, and then what do you do after that at 6 at 7? So sometimes they will say, oh, I'm making dinner. Okay, and then I will wash the dishes, and then probably at 8 or at 9, then I have my own time. But at that time, when I ask, so what time do you go to sleep? 11 or 12? Oh, okay, so between the 9 to 11 or 12, what did you do? So mostly they will be like, watching the TV or anything like that to distress myself lah for tomorrow, you know. Okay, so I was like, okay, can you put in at least 30 minutes or 1 hour to, I mean 30 minutes is also fine, you know, just come and, you know, and panggil your children and be like, oh, so how are you today? Do you have anything that you want to talk to me? You know, because as I said, the children always looks to your behavior, and then they will analyze themselves, right? So let's say you are giving them everything and they are the aces, you know, the top student. So why do they still cut themselves? Okay. Why do they still think about suicide and wanting to die? So the thing is because they always feel like to earn your recognition and to earn your notices is if they get the aces or the scores top number 1, 2, 3, you know. So they will feel like if they don't get that number, that make you feel like, oh, I'm so proud of you, because probably at that time only you feel like, oh, I'm so proud of you, but at another time you don't say that you are proud of them. You know. So they will feel like they are a failure, so it kinds of like give them a lot of stresses to always become number 1. So that's why they will end up trying to, you know, cut themselves or thinking that, oh, this is too hard. But I cannot tell my parents it's too hard because they always think that I'm the genius that I can, you know. So that's why I always teach my children to be average, you know. So one day when I was playing with her and she got B, I was like, oh, that's good, you know. And then she was like, why are you clapping? And I was like, you got B, that's good enough. And she's like, but I want A. So I was like, oh, okay, I did not put the expectation, but she put that on herself. This is going to be an issue. I'm like, this is going to be an issue later. I'm going to talk to you later. Yeah.
Yeah, you want it so much and you couldn't get it, also another issue, right? That will be another pressure on them. So it's never like what Jennifer say. Children in such traumatic situation, like that's not abuse, they have literally no one to turn to if parents don't see it, don't see the parents or the cry for help. So thanks, Jennifer. Jennifer also a very awesome lady. Yeah, she encountered many problems physically or all this, but she's managed to, and she's really wonderful lady as well. Yeah, so there are so many things that we can talk about with 𝗓𝗨 that never ends. Also because as you say, I also start to feel as a parents, they are. Yeah, no doubt my children are big now, but there are many things that we can do last time, but as what you say, we still can do it now. Even children when they are big, they still need a friend that they can listen to. Listening to them is never too late now. What I feel is So for friends, whoever that you do have any question, please also can write down. 𝗓𝗨 will go through and maybe by somehow able to assist us or whatever it is lah. So it's time we still have to say bye bye to 𝗓𝗨, and thank you so much for your sharing. No doubt it's really short and it's really very informative to all of us. So before we say bye bye, would you like to say anything to my friends here, our viewers here? Yeah.
Okay, so everybody who is watching today, thank you so much. And also thank you, Auntie Boleh, again for inviting me. Okay, so I hope that whatever that I share today can be very insightful, and maybe you can practice it at your home, especially the Deci Technique, you know, and then the signs that you can be aware of if something is wrong with your children. If you feel like you can handle it, talk to them. They always need their parents. But if you like you can't handle it, then yeah, you can call up to me or reach out to actually you can always reach out to any of your other siblings too. If you have a lot of siblings, you know, it's very good to keep the family together. So that if you don't want orang luar untuk know the problem, then maybe you can call your sister or brother and be like, oh, can you talk to my son? I think something's wrong with this, but they don't want to talk to me, but maybe you can talk, because I feel like, so this is why family is very important. All right, okay. So yeah,
Relationship always must have the tie is always there. Yeah, yeah. Thank you
yes,
so
yeah,
much. Yeah.
yeah.
So,
All right, thank you so
so it's
much.
time we're gonna say bye bye to everybody, and let's continue to support Auntie Bole. Okay, it's time to say bye bye. And Auntie Bole loves to share. I hope everybody will help me to share my page and continue to like, and share. Okay, it's time to say bye bye. Bye for
Okay, bye.
3, 2, 1. Bye bye, everybody. Bye bye.